Welcome to the We Level Up Treatment Center video series. In today's video, we will discuss what drugs are in ecstasy. What is in ecstasy? Ecstasy, the drug, is a street name for an illicit substance that typically contains MDMA, 3-4, methylene deoxymethamphetamine, as its primary active ingredient. MDMA is a synthetic psychoactive drug that produces feelings of euphoria, increased energy, and altered sensory perception. Other ingredients that may be present in ecstasy tablets include caffeine, ephedrine, ketamine, and other stimulants or hallucinogens. Molly is another slang term used to refer to MDMA, but it typically implies a higher purity or quality of the drug compared to ecstasy tablets. However, there is no guarantee that any drug sold as Molly actually contains pure MDMA, and it can be just as dangerous as the drug's ecstasy if it is adulterated or contaminated. MDMA is the chemical compound that is responsible for the effects of both ecstasy and Molly, and it is the active ingredient that is sought after by users of these drugs. It is a stimulant and a hallucinogen that acts primarily by increasing the activity of serotonin, a neurotransmitter that is involved in mood regulation and perception. However, the terms ecstasy and Molly are often used interchangeably with MDMA, even though they technically refer to different forms or preparations of the drug. What other drugs are cut in ecstasy? The drug's ecstasy is often cut with a variety of other drugs or substances, which can vary depending on the region and the specific batch of the drug. Some common additives or contaminants found in ecstasy tablets include: caffeine is a stimulant that can increase alertness and energy. Methamphetamine is a highly addictive stimulant that can produce feelings of euphoria and increased energy. Ketamine is a dissociative drug that can produce sedative, hallucinogenic, and anesthetic effects. Methylone is a synthetic drug that is chemically similar to MDMA and can produce similar effects. PMMA is a synthetic stimulant that is much more toxic than MDMA and can cause severe side effects, including death. Bath salts are a group of synthetic cathinone that can produce stimulant and hallucinogenic effects, but can also be highly unpredictable and dangerous. It is important to note that these additives or contaminants can significantly increase the risks and side effects of taking drugs, ecstasy, and can even be life-threatening in some cases. It is always safest to avoid using ecstasy drugs or any other illicit drug altogether. Ecstasy side effects. How long does ecstasy effects last? The effects of ecstasy, also known as MDMA, typically last for 3 to 6 hours, although the duration can vary depending on the dose, the individual's metabolism, and other factors such as the presence of other drugs in the body. After ingestion, ecstasy is rapidly absorbed into the bloodstream and distributed throughout the body. Its effects usually begin within 20 to 60 minutes and peak after about 1 to 2 hours. The user may experience increased energy, euphoria, emotional warmth, and a sense of empathy and connectedness with others. Ecstasy, the drug, also known as MDMA, can produce a range of physical and psychological side effects. Some of the most common side effects of ecstasy pills may include the following: increased heart rate and blood pressure, muscle tension and jaw clenching, nausea and vomiting, dehydration and overheating, blurred vision and rapid eye movement, dizziness and lightheadedness, loss of appetite and weight loss, insomnia and restlessness, anxiety and agitation, depression and irritability, impaired memory and concentration. In some cases, ecstasy drugs can also lead to more severe or life-threatening side effects, which may include the following: seizures and convulsions, cardiovascular complications such as heart attack or stroke, hyperthermia, elevated body temperature, and dehydration can cause organ damage or failure. Serotonin syndrome is a potentially fatal condition that can result from excess serotonin in the brain. It is important to note that the risks and severity of ecstasy pill side effects can be influenced by a variety of factors, including the dose, purity, and frequency of use, as well as individual factors such as age, weight, and health status. Long-term use of drugs ecstasy can also lead to persistent or permanent changes in brain chemistry and function. Therefore, it is safest to avoid using drugs ecstasy or any other illicit drug altogether. Ecstasy, effects on brain and mental health. Ecstasy drugs, also known as MDMA, can have both short-term and long-term effects on mental health. In the short term, ecstasy can produce intense feelings of euphoria, empathy, and sociability, as well as increased sensory perception and a sense of emotional openness. However, these effects from ecstasy are often followed by a crash or come-down period in which users may experience irritability, depression, and fatigue. Ecstasy long-term effects can lead to a range of mental health issues, which may include the following: anxiety disorders. Ecstasy can increase anxiety levels, and chronic use can lead to the development of anxiety disorders, such as panic disorder or generalized anxiety disorder. Depression. Ecstasy effect on brain often includes depression. Ecstasy can deplete the brain's supply of serotonin, a neurotransmitter that is involved in mood regulation. This can lead to depression, which can persist even after the effects of the drug have worn off. Cognitive impairment. Ecstasy brain effects may include long-term changes in brain chemistry and function, which can result in impaired memory, attention, and decision-making skills. Psychosis. Ecstasy drug effects may include psychosis. Chronic ecstasy use can lead to the development of psychotic symptoms, such as hallucinations, delusions, and disordered thinking. It is also important to note that ecstasy use can worsen pre-existing mental health conditions, such as bipolar disorder or schizophrenia, and can increase the risk of suicide and self-harm. Therefore, it is safest to avoid using ecstasy or any other illicit drug altogether, especially if you have a history of mental health issues. Effects of ecstasy on your physical health. Ecstasy, also known as MDMA, can have a range of physical effects of ecstasy on the body. Some of the short-term effects of ecstasy use may include the following: increased heart rate and blood pressure. Ecstasy effect on the body can cause a surge in heart rate and blood pressure, which can be dangerous for individuals with pre-existing cardiovascular conditions. Muscle tension and jaw clenching. Ecstasy can cause involuntary muscle contractions, particularly in the jaw and neck muscles, which can lead to dental problems and muscle strain. Dehydration and overheating. Ecstasy can increase body temperature and decrease the body's ability to regulate its temperature, which can lead to dehydration and overheating, a potentially life-threatening condition known as hyperthermia. Nausea and vomiting. Ecstasy can cause nausea and vomiting, which can lead to electrolyte imbalances and dehydration. Blurred vision and rapid eye movement. Ecstasy can cause eye twitching and rapid eye movements, which can result in blurred vision and eye strain. In the long term, ecstasy use can lead to more serious and potentially irreversible physical health issues, which may include the following: cardiovascular complications. Ecstasy can cause long-term damage to the heart and blood vessels, increasing the risk of heart attack, stroke, and other cardiovascular problems. Liver and kidney damage. Ecstasy use can cause damage to the liver and kidneys, which can result in liver or kidney failure. Impaired immune function. Ecstasy can suppress immune function, increasing the risk of infections and illnesses. Neurological damage. Ecstasy can cause long-term changes in brain chemistry and function, which can result in neurological problems such as tremors, seizures, and memory loss. It is important to note that the risks and severity of ecstasy's physical effects can be influenced by a variety of factors, including the dose, purity, and frequency of use, as well as individual factors such as age, weight, and health status. Therefore, it is safest to avoid using ecstasy or any other illicit drug altogether. We Level Up NJ Rehab Treatment and Detox Center can provide you or someone you love the tools to recover from this with professional and safe treatment. Please know that each call is private and confidential. That's it for today. Please subscribe and hit the notification bell. Like, share, and comment. We would love your feedback. Have a great day.